Hey again, Grandma. I hope you're ready to discuss another topic I learned this week. Today I'm going to talk to you about pneumonia. I'm sure you've heard of it because it's a pretty popular disease, but I want to describe to you what it actually is biologically, and we're also going to talk about how to diagnose pneumonia, so how to find out that you have it and how to prevent it. So let's get started. So before I actually tell you what pneumonia is, let me explain to you in detail infections of your respiratory system, which is the breathing system that we use to breathe with. There's going to be two types of respiratory infections that you can get. There's either acute or chronic. So acute is going to be something less that lasts for less. So maybe just 30 days or a cold or something. Chronic is going to be something that you're going to have for a longer time, like maybe asthma. So both of these can happen in the upper part of your respiratory system or the lower part. And the upper part includes like your nose area, the nasal cavities. Let me show you. So this is what a normal person looks like on the inside. The upper part, so the upper respiratory tract, includes your pharynx, your larynx, and your nasal passage. So, so everything kind of up here. And your lower respiratory tracts are going to include your trachea, which is that bumpy thing that you feel when you feel in your throat. And you're going to have your lungs and the bronchi, which are kind of the branches that lead to each of your lungs, the primary bronchi. Sorry. And that also includes the secondary and the tertiary and the quaternary bronchi that are inside your lungs, as well as the bronchioles and the alveoli, which is where at the basic level your blood takes oxygen that you breathe in and uses it for the rest of your body. So acute respiratory illnesses are normally what's most common. So you've had acute respiratory illness, I've had one, everyone's had one, it's pretty common. So you've had a cold, right? That's an acute respiratory illness. But that's because it was an upper one, so kind of in your nose or you felt really congestion. It wasn't that serious. But what gets serious is when you have a lower respiratory infection, so something that happens in your bronchi or your lungs, that's pretty serious, and that's something like pneumonia. So what exactly is pneumonia? I know the name is thrown around all the time, and it's pretty well known. So simply put, pneumonia is an infection of the lungs. So what actually happens in the body when someone gets pneumonia? More technically, the air sacs inside the lungs become swollen and inflamed, and they get filled with liquid or pus. You know how we get pimples? Yeah, it's inside your lungs, and that's not very good. And so, how do you normally get that? So pneumonia can either be caused bacterially or virally. So a bacteria can cause it, or a virus can cause it. The most common bacteria that causes it is called Streptococcus pneumonia, and because it's a coccus type of bacteria, they look like little dots like that. Or you can have a respiratory syncytial virus, and they kind of look like little fuzzies like that under the microscope. So I know you're not a doctor, but the most important part of this little lesson that I'm giving you today is the diagnosis. So how do you know if someone has pneumonia or not? Well, there are a couple things that doctors do that I'm going to tell you about, but they do a lot of tests and stuff that they can do, but I'm going to tell you about the most important ones. So first, when you're a kid, has a fever, cough, a lot of phlegm, just feel really stuffy up here, you're going to go to a doctor, right? The first thing that they're probably going to do is they're going to take out their stethoscope and listen to your lungs. And what doctors normally describe the sound inside your lungs is, they say it's crackly or bubbly if you have pneumonia. I've actually worked with a physician who said it sounds like you have a washing machine going on inside your lungs. So it doesn't sound good. So the second step is, if your lungs sound really bad from the stethoscope hearing, they're going to take a blood test. And what this blood test does is that it checks for white blood cells. Normally, if you have a really high count of white blood cells in that blood test, it means you have an infection. So if your lungs sound bad and you have a high blood cell count, white blood cell count, they're going to ask you to go get an x-ray. So you can go get an x-ray, and you know how that works. They just look inside your body, they take a scan of your lungs. And if a couple of radiologists, people who read those x-rays, they get together and they look at them, and if they agree that you have pneumonia, you've got pneumonia. So, a lot of times, also, another way that you can tell that children have pneumonia is when you breathe, when you breathe in, your chest expands. So, because you're inhaling, you're taking in a lot of air. So, take a breath for a second. You see how your chest expands? Well, a lot of times kids with pneumonia, whenever they breathe in, they actually see their chest going inside, and that's not a very good thing. So how do you prevent it? Remember last week I told you about the World Health Organization? So they have a couple of tips on how to keep pneumonia out of the house. Their first suggestion is they suggest mothers who have young babies, newborn babies, they suggest for them to be breastfed for 6 months. They said that it's associated with 15 to 23% decrease in pneumonia in children. So it's a lot of kids that you can prevent from getting pneumonia if they are just breastfed at childbirth. Also, just as any other disease, they want to make sure that your children are well fed, nutritious food. So you want to keep their nutrition up and make sure that they're hygienic. So wash their hands. But the biggest thing is you should wash the pollution inside your house. So eliminating pollution sources inside the house greatly by 75% decrease incidence of childhood pneumonia. So I mean, so next time our little cousins are around at your place, make sure that your stoves are clean. Maybe you have your kitchen exhaust fan on, and make sure that nobody smokes. So that's all for today, Grandma. I hope you learned something new today. Bye.